I think anybody in the healthcare profession has to realize that it's not just a way to make a living.
You're able to make such an impact in somebody's life.
I was in the hospital, I kind of had a bad experience, and one of the nurses I had made a huge impact, and I just remember talking to her and her making me feel better.
That's the reason I became a nurse, is I had, when I was younger, I had to have surgery, and the nurse was so kind, and I thought, I want to do that.
I knew I found what I'm going to be when I grow up. I think within a few weeks after I started my job here, I felt that this is really where I belonged.
Helping other people, it makes me feel good as every single day coming to work. I enjoy my job a lot.
I show up every day because I don't know who's going to call me or who's going to show up that needs help. And that excites me, that I'm going to be able to help someone every day.
It's not something that I have done on my own. I really believe that, you know, it's a gift, is something that we do for others. That's how I see the job.
When my last career in medical was bringing me more away from patient bedside and more I was in pharmacy, so I was in like a locked room a lot. I realized I wanted to see people. I knew I wanted to go back to school to expand my career opportunities, and I just knew I wanted to see people. Like, I wanted to be at their bedside and help them in the most critical times.
My wife is actually an employee here as well, and she was working out here at the time when I was in a transitional phase. I was ready for a change and ready to go back to school, and I didn't know what, but I knew that technology and healthcare were always going to be the biggest growth sectors, and I loved helping people, so I figured I would get into healthcare so I could apply both my customer service and people skills to helping people.
Probably when I was like 15, I was a little candy striper in a nursing home, and my first job was in a nursing home, and I've just always stayed in the healthcare realm. I was just kind of drawn to it.
I needed to be, you know, in contact with people. I used to work in the laboratory, which it was just a few of us, and we spent most of the time in this little room and, you know, not having contact with anybody else. And so when I find out that there were some need here in the North Nevada, so then I said, well, I'm gonna try that. And, you know, I guess God put me in the right place, because, you know, since then I kept doing the same thing. I raised all my kids doing this job.
Caregiving, that started me. And I was just like, oh, I love this kind of job. I like making people comfortable, helping them to be comfortable.
I'd been away from nursing for such a long time, I wasn't able to renew my license. So I really struggled with not being able to do what I felt kind of I was put on this earth to do. Looking for something to occupy my time and fill that void, and Carson Valley Medical Center just kind of called my name.
Carson Valley has given me not only a purpose, but a new identity.
The only way to describe it is more of like a family environment. It's smaller, people help each other, it's very community-centered.
The moment I walked through the door, just into orientation, it was like arms wide open, everybody knew your name. It was like the perfect little small town hospital. They actually won me over from a bigger hospital.
You walking around the hospital and they can see you and they call you by your name. Hey, Rodrigo, how you doing? You know.
Sincerity, that they care about you and your well-being, and I think that's what I love about this hospital the most.
I live here. I get to help the community navigate the healthcare system with what I get to do here.
I am very proud because our hospital reaches out to the community a lot. Everyone's pretty much had their hand in Carson Valley Medical Center before and has used our facilities in some way.
I've made lots of friends here. I like everybody that I work with. That's what family is about, is having someone to talk to and confide in and share in happy moments and sad moments, and I feel like that I have that here.
I get to work with the various departments, I get to work with the community, I get to work with the patients that are coming in, they have questions. It's just an awesome experience. A lot of great things go on here, and you feel really good about and proud to be a part of it.
and actually a lot of different needs fulfilled in this community that weren't available before we had this hospital here. I used to drive to Reno to be a nurse, and that was my big incentive, was to work in my community and take care of my people. So that's been a great opportunity for me.
People don't have to drive all the way to Carson City or Reno to get medical care.
It offers them the ability to get to an emergency center within minutes in a small town rural area.
First time we ever came was for probably something minor, and it just went on from there. This was the hospital we came to first.
Well, having my doctor here in Gardnerville is very fortunate. He's actually about 3 miles away from where we live.
I'm happy to come to work every day. I enjoy what I do. I couldn't imagine doing anything else.
And, you know, I'm more than willing to do anything to make them feel better, you know.
And we want people that want to be part of the family and part of the team.
I'm completely happy. This is what I want to do.
Carson Valley has given me not only a purpose, but a new identity.
The people of Gardnerville and Minden, they've been blessed with the best.
It's a community hospital that I would recommend to my family for sure.
A feeling of belonging somewhere, and that's what the hospital is. You belong here.
We would be nothing without the community. We're here for the community.